My name is Michael. I'm 45 years old, and lately I've been experiencing some weird symptoms, so I'm going to head to the doctors and I'm going to see what they have to say. Hi, Dr. Shifflett. I'm here today because I've been experiencing some issues lately. I believe they're muscular related because when I walk, my foot doesn't seem to be stepping properly, and it doesn't feel like I can control it. I can demonstrate it for you if you'd like me to.
Yeah, okay. Hi, Michael. Yeah, definitely. Let's see it. Alright, yeah, interesting. So it appears you have something known as a slapping gait, in which your foot sort of slaps down on the ground rather than stepping gracefully, heel to toe. So are there any other symptoms you can describe to me?
Yes, actually, when I try and write something down, usually my wrist isn't able to stay up properly. It's a bit hard to explain, but
Alright, Michael. Well, there are a few things this could be. I would like to rule out a neurological issue before I go into the details of other less serious medical conditions that you could have. I'm going to run an extensive EMG that will take a couple hours to display feedback. Would you like to stay here in the waiting room and await the results, or would you like me to give you a call tomorrow?
I think I'm okay with waiting. I can stay here.
Okay, great. So what the EMG is going to measure are the electrical signals exchanged between your brain and your muscles. And it's going to let me know if there are any neuromuscular abnormalities in your body. The EMG uses tiny devices called electrodes in order to obtain this information. Inserting the electrodes will feel like getting a couple shots, but nothing extremely painful. Are you ready?
Yes.
All right. Follow me. So after conducting your EMG, I've found no other significant abnormalities that would point me in the direction of another medical condition. I'm afraid I'm going to be diagnosing you with limb-onset amyotrophic lateral sclerosis, or ALS. There is evidence of lower and upper motor neuron degeneration, and I'll explain to you what all of that means. So in the normal human body, motor neurons of the spinal cord send signals to the muscles in order to execute and coordinate movement. The muscles will contract, allowing for that voluntary movement. In ALS, these voluntary muscles can no longer receive those signals from the brain. Allow me to elaborate on the specific processes involved in this loss of ability. In a normal human brain cell, or a neuron, the neurotransmitter glutamate is synthesized in the terminal of the presynaptic cell. There's a presynaptic cell and a postsynaptic cell, the presynaptic cell releasing the neurotransmitter and the postsynaptic cell collecting it. The glutamate in the presynaptic cell is driven into a clear core vesicle by enzymes originating in the axon terminal of the neuron, which allows for the release of glutamate across the synapse, towards the postsynaptic cell. The glutamate can then either bind to a receptor, or can be removed from the synaptic cleft through glial processes and transporter proteins, such as excitatory amino acid transporters, EAATs for short. The removal of this glutamate maintains a correct balance of the neurotransmitter in the central nervous system and causes the ultimate avoidance of excitotoxic neuronal damage. Excitotoxicity involves damage being done to the neurons due to their overstimulation by a certain neurotransmitter, which, in this case, is glutamate. This damage is what is occurring in ALS, also known as Lou Gehrig's disease, named after a famous baseball player. Studies have been conducted that have determined that one of those EAAT transporters, EAAT2, is reduced in ALS patients, leading to increased extracellular glutamate. This glutamate is toxic and leads to the overstimulation of those glutamate receptors, causing calcium to flood into the cell and an influx of sodium, and both of these positively charged influxes cause repeated excitatory responses in the neuron. Therefore, motor neurons will fire rapidly and at an abnormal rate. This process makes up part of the excitotoxic degeneration of the motor neurons that control muscle movement, and therefore the ability to control your muscles is slowly lost. But that's not all that's going on. Before I continue, let me show you a diagram so you can better understand this physiology. So there's also a really large amount of mitochondrial dysfunction in the body during ALS. Mitochondria in normal physiology assist in converting energy into ATP and prove vital to the human metabolism. In ALS patients, there is a misfolded enzyme called SOD1 that is deposited upon the spinal cord mitochondria. These deposits lead to an impaired degradation and recycling process of the mitochondria, resulting in abnormal distal axons, the axon being the main transportation route through the neuron, and deficient ATP production. With mutant SOD1, axonal transport is essentially compromised in ALS patients. In the human body, motor neurons, as I spoke about before, have long axons that can extend all the way to your toes. In ALS patients, the defectiveness of that axonal transport in regards to motor neurons causes a buildup of neurofilaments, blocking the flow of nutrients through the axon entirely. This is known as axon strangulation. Together, all of these physiological dysfunctions, in addition to other various motor neuron-related abnormalities, make up the pathophysiology of ALS. The brain's ability to initiate and control muscle movement, as I mentioned before, is lost over time, and a gradual but continual decline in strength leads to the total loss of muscle function and paralysis. So over here we have a normal neuron. There's the cell body up here, the soma with the nucleus in the middle, dendrites extending out, and then the long axon right here, going all the way to the skeletal muscles. Over here we have the average neuron or motor neuron in an ALS patient, as well as the physiology behind this whole glutamate process and degradation, etc. So up here we have the presynaptic cell, as I spoke of, and then over here we have the postsynaptic, and that would be this whole neuron here. So glutamate is being released over here in the presynaptic cell, driven into this clear vesicle right here by an enzyme, and then it's being released across the synapse and picked up over here by the postsynaptic neuron and creating a positive excitatory response that will flow all the way down, all the way to the next axon terminal. But over here, we have EAA2, as I mentioned before, as being defective in an ALS patient. So this is essentially, it's destroyed.
Wow, can something like the mitochondria in my body be fixed?
At this time, mitochondria are the target of ALS treatment and therapy, but no drug has yet proven helpful in fixing this mitochondrial issue.
I don't understand how I got ALS though. No one in my family history has it.
Well, only about 5% of ALS cases are genetically linked. Nearly 95% of all ALS cases are sporadic, and a number of factors have been theorized to be linked to the sporadic development of ALS. These factors include lead exposure, pesticide and formaldehyde exposure, and large consumption levels of foods containing glutamate and fat. Unfortunately, it's extremely difficult to isolate a single environmental factor as being the cause of an individual's ALS.
What can I do to slow down the process of ALS?
There isn't much you can do to slow down the process, but as your symptoms become more debilitating, there are certain accommodating procedures that can be done in order to maintain quality of life.
So what are those things? Will I die of ALS, and if so, when?
So the life expectancy for an early diagnosis of ALS is generally 2 to 5 years. ALS ultimately disables your ability to swallow and breathe, and both of those things are essential to staying alive. A pacer can assist in helping you breathe, and a feeding tube can maintain healthy nutrition. Unfortunately, ALS renders patients unable to talk or communicate manually, and though this is not life-threatening, many patients become quickly frustrated by this. Have you heard of Stephen Hawking?
Yes, isn't he very old with this condition? How is he still alive?
So Stephen Hawking was diagnosed in his early 20s with ALS, so there is a chance that he has juvenile onset ALS, which has been studied to show that progression can be significantly slower and last many, many years. Of course, I have never examined Stephen Hawking myself, so I cannot say for sure, but Stephen Hawking got a new form of communication started for those unable to speak. He uses a sensory computer to type characters that he wishes to say aloud with the movement of his cheek. Others, such as ex-football player Steve Gleason, coordinate characters with eye movement across a virtual keyboard in order to communicate. Later down the line, this may be some technology you want to consider as part of your daily life.
This is a lot to take in. I appreciate your help, but this is a lot to deal with right now.
For now, let's focus on a step-by-step basis. I will see you back here in 2 weeks so that we can discuss anything else you would like to discuss in regards to ALS after you've gone home and conducted a bit more research. I will also refer you to a medical counselor who specializes in diseases of the nervous system. This person will be your personal suggestion maker and confidant throughout your progression of ALS, as well as someone to whom you can ask various questions whenever they come up.
All right, thanks, Dr. Shifflett. I'll be in touch.
You're very welcome, Michael. Try your best to remain positive. I know this diagnosis is a difficult one. Have a good week.
Thank you.